Do you go on your period while pregnant? Let's begin by understanding what a period is. During a period, the lining of a woman's uterus sheds. This cycle is part of a woman's reproductive system and prepares the body for a possible pregnancy. In this video, we take an in-depth look at women's monthly period or menstrual cycle and pregnancy. The menstrual cycle occurs to facilitate pregnancy. Ovulation is when the ovary releases an egg. This occurs midway through the cycle. When released, an egg is only viable for a few hours. If sperm cells are present and able to fertilize the egg will implant itself in the uterus, resulting in pregnancy. If there is no fertilization, menstruation will occur, and the body will shed the uterine lining so that it can begin making a new one for the next cycle. So your question is, can you get your period while pregnant? The simple answer is no. When a woman is pregnant, she does not continue to ovulate and will not have a period. Menstruation only occurs when a person is not pregnant. However, it is possible for women to experience some bleeding during pregnancy, though this will not be due to their menstrual cycle. While bleeding is not necessarily a sign of an underlying problem, it is essential to understand the potential causes and know when to speak to a doctor. Bleeding tends to be more common during the first trimester. Some mild spotting can occur as the placenta implants in the uterus. A woman can also experience changes in the cervical cells during pregnancy, which may cause some light bleeding, especially after having sex. Other causes of bleeding in the first trimester include ectopic pregnancy, which is a medical emergency, an infection, miscarriage, or pregnancy loss. Subchorionic hemorrhage occurs when bleeding occurs between the uterine wall and the placenta. Gestational trophoblastic disease, GTD, a very rare condition that can simulate pregnancy by causing a tumor that may contain abnormal fetal tissue. Causes of bleeding later in pregnancy may include cervical examination. A doctor may inspect the cervix to check for any abnormalities. This procedure can result in some minor bleeding. Placenta previa. This is a condition that occurs when a woman's placenta implants close to or on the cervical opening. Preterm labor or labor and sexual intercourse. Uterine rupture. This is when the uterus tears during labor, which is a medical emergency. Placental abruption. This is a condition in which the placenta begins to separate from the uterus before the baby is born. It is also a medical emergency. When to see a doctor. If a woman does experience bleeding at any stage of pregnancy and is concerned, she should note the color, amount, and consistency of the bleeding and speak to a doctor. Women should seek emergency medical attention for bleeding during pregnancy if they have additional symptoms that include pain and cramping, dizziness or fainting, heavy bleeding or passing clots, severe pain in the stomach and pelvis. A woman should also see a doctor about bleeding that is bright red and soaks a pad. If a woman is bleeding and has symptoms of preterm labor, which is labor before 37 weeks of gestation, she should seek medical attention. These symptoms may include a constant ache in the lower back, abdominal cramping, and regular contractions. Bleeding during pregnancy does not indicate that a woman is having her period. Sometimes the bleeding can be the result of regular changes in the body during pregnancy. Heavy bleeding may indicate a health issue that requires treatment. If a woman experiences bleeding during pregnancy, she should speak to a healthcare professional for guidance.